Hi, everyone. This is Anna from the Tennessee Justice Center. We're going to get started in about 5 minutes. I just want to do a quick sound check. So if you can hear me clearly, can you type into the question box that you can hear me? Thanks. Hi, everyone. This is Anna Walton from the Tennessee Justice Center. Thank you for attending our Insure Kids, TennCare and Covered Kids Eligibility and Enrollment, the Basics training. Insure Kids is a statewide campaign to enroll every eligible but uninsured child into our public coverage options, which are TennCare and Covered Kids. And we're just going to talk more about those today, what the eligibility requirements are, and how you can help get kids enrolled. The webinar is going to be about 45 minutes, and we'll have time for questions and answers after. If we don't get to your questions for some reason, we'll email you after and answer your questions. And we're also going to send the slides and a recording of the presentation after, so don't worry too much about taking a ton of notes. And with that, I'll introduce Kanika Young, the Director of Children's Health at TJC, to do the webinar.
Thanks, Anna. Good afternoon. Hi, thanks for joining us today. So we'll just jump right into our presentation. First, we'll start off by talking about the long-term effects of comprehensive health coverage for kids. Studies have shown that children who have access to health coverage do better in school. They tend to miss fewer days of school due to illness or injury, and they're more likely to finish high school, attend college, and even graduate from college, which sets them up to do better as adults and have fewer emergency room visits and hospitalizations and earn more on their jobs. So we think that insuring children is one of the easiest ways we can improve their chances of succeeding and build a healthy future for everyone in society. Most people may be surprised to learn that almost every child is eligible for something. Our focus today is on the public coverage options. As Anna mentioned, they are TennCare and Covered Kids. So TennCare is Tennessee's Medicaid program, Covered Kids is the CHIP program, and then there's a third category that's sort of a hybrid between the two that's called TennCare Standard. So those are the three public coverage categories that we'll be talking about today. So first up is TennCare. This is Tennessee's Medicaid program. It is a federal-state partnership, so the federal government sets certain standards and parameters for every Medicaid program, and then states have the flexibility to administer the program in their state as they see fit. It's common knowledge that different states will set different priorities and have different options within their programs, so there's a lot of variation among the various states. The running joke is if you've seen one state Medicaid program, then you've seen one state Medicaid program because they can be quite different. In Tennessee, about 1.5 million people are enrolled in TennCare. It covers over half of all Tennessee children, covers half of the babies born in Tennessee, and is a significant funder for the state's network of neonatal intensive care units. It's also the single most important payer for services for children who have severe health care needs. So this is a significant program in the state with lots of lives depending on it. So we want to make sure that people are aware of how important the program is and that they are accessing what it provides in case people need it and qualify for it. So a little more about TennCare benefits. Something that is very beneficial for TennCare enrollees is what's called the Early Periodic Screening, Diagnostic, and Treatment Standard. So it's shorthand referred to as EPSDT, and it requires that all children on Medicaid receive anything that's medically necessary as determined by a doctor. So that would include periodic and interperiodic assessments of growth and development, immunization, lead poisoning testing, as well as comprehensive vision, dental, and hearing services, and as well as anything else that's medically necessary for diagnosis and treatment of a condition that a child may have. So Covered Kids, by comparison, is also a federal-state partnership under the Children's Health Insurance Program, or CHIP. Covered Kids provides health insurance for eligible children who are 18 and younger, as well as for eligible pregnant women. And for pregnant women, one thing to note is they are eligible regardless of immigration status. The idea being that the woman is carrying a child who will be born in Tennessee, so that child should have access to prenatal care as a citizen, a natural-born citizen. So Cover Kids is available for those pregnant women regardless of immigration status. As of fiscal year 2017, there were over 103,000 children enrolled in Cover Kids in Tennessee. And it's a significant program because the federal government pays the large portion of the cost associated with the program, with the state having to kick in less than 1% to cover over 100,000 children. So it's a very economical option for the state that allows it to cover a lot of kids for a relatively small investment on the state's part. Cover Kids benefits are a little different from TennCare because there's no EPSDT standard, but it still provides very good benefits, including preventive health services, doctor visits, hospital visits, vaccinations, well-child visits, as well as developmental screenings and mental health. There's also an option for children to get vision and dental care. It's modeled after the plan that state employees are offered, and it is managed by Blue Cross Blue Shield of Tennessee. That is the managed care organization that administers the Cover Kids benefits. Cover Kids also has a cost-sharing element that people should be aware of because it is for families who may be a little above the income threshold for TennCare, and we'll talk about that income threshold in a second. But there is a cost-sharing component to it, but it can exceed 5% of the family's income, and it varies depending on the service that the person is seeking. However, there's no cost sharing for well baby and well child visits, including immunization. So the family may have to pay a copay depending on the service that they are seeking, or may have to meet a deductible, but it's usually reasonable for the coverage that they're seeking. So that third category that we mentioned at the beginning is TennCare Standard, and I say it's sort of a hybrid between TennCare and Cover Kids, because the TennCare Standard beneficiaries are funded, or the services provided are funded through CHIP, but the program is only available to people who at one point qualified for TennCare. So for children who are under 19 that were on TennCare but become ineligible for some reason, usually because their income has changed, then they can sometimes roll into TennCare Standard up until they turn 19. There are certain criteria for TennCare Standard. So one is they cannot have access to group health insurance. And when we say group, we mean typically what you would see as an employer-sponsored plan, where an employer would offer a plan to their employees and the beneficiaries or dependents of their employees as part of their employment benefits. So it doesn't count if the person has an individual plan that they purchased on the federal marketplace. Another criteria is that the beneficiary or enrollee has to be a U.S. citizen, U.S. national, or eligible non-citizen, and they have to meet an income threshold. So if they are below 211% of the federal poverty level, which is about $52,000 a year for a family of four, they qualify or they're eligible. But if they are above that income limit, but they also have a qualifying medical condition that could have prevented them from getting health insurance prior to the Affordable Care Act, then they may be eligible for a TennCare Standard. And the reference to the Affordable Care Act is because, as you know, this law basically did away with the underwriting process that insurance companies were allowed to engage in before it was passed. So if there was a certain medical condition that an insurance company didn't want to cover because it would be expensive, then the Affordable Care Act said you can't deny people insurance because of their pre-existing conditions or charge them higher premiums because of that. So this is an acknowledgement of that change in law that now allows those people to access the insurance plans on the individual marketplace. But this acknowledges that there are certain conditions that are very serious illnesses like cerebral palsy or congestive heart failure, even lead poisoning and juvenile diabetes that pre-ACA could have prevented these kids from getting coverage, but now they do have access to roll into TennCare Standard if they have one of those types of conditions and are above the income limit. It's important to note that TennCare Standard is not open to new applicants. It must be a situation where the child has been deemed no longer eligible for regular TennCare, and they would ideally TennCare would screen this person for TennCare Standard at the time that they're making that redetermination, but that does not always happen. So the way it normally plays out is the person would get a letter from TennCare saying, we've determined that you're no longer eligible for TennCare. And at that point, if they don't offer TennCare Standard in that redetermination letter, then the family would need to appeal to TennCare and say, hey, you told me I'm not eligible for TennCare, but what about TennCare Standard? And there's a number for the Tennessee Healthcare Connection that will share that people should call if they want to inquire about TennCare Standard. So just to give you an idea of the breakdown of coverage for children in Tennessee, there are about 1.5 million children in the state, and over half of them are on TennCare, so roughly 772,000 children in the state. In terms of TennCare Standard and Cover Kids, those numbers are reported together again because it's the same pool of funding, and that is over 100,000. The marketplace comes in at about 21,000 children. Employer-sponsored plans where an adult has put a child as a dependent on their employer-sponsored plan, that accounts for about 686,000 children, and then uninsured is 53,000. The uninsured but eligible number is 34,640, and those are the children that we are really hoping to reach through the Insure Our Kids campaign so that we can make sure that they have the information they need to get enrolled and that they have assistance if they need it for accessing TennCare and Cover Kids. Here we see that different counties are doing better than others in terms of insuring children. The highest uninsured rates, though, are in the most populated counties, which are Shelby, Davidson, and Knox County. So we really want to concentrate our efforts in those places by doing outreach and getting the information in the hands of people who need it. Okay, so now we get into some math. Eligibility. So TennCare and Cover Kids are available to children categorically, but they also have to meet certain income limits. Not all income is counted, so this is just to give you an idea roughly of those income limits. There may be situations where someone thinks they're over income, but certain things can be deducted to bring them under income. So we encourage people to apply even if they think they're a little bit over the income, because there are things that they can just subtract from their income, such as legally obligated alimony, student loan interest, and certain educator expenses can be deducted from your income for purposes of applying for these benefits. But here you see that the income limits also vary by family size. So looking at a family size of 4, you see that the upper limit at 250% of the federal poverty level is $61,500. And that 250% marker is for Cover Kids. So anyone earning up to that amount could qualify for Cover Kids, depending on their family size. And then at 211%, which is the next column, that is the line of demarcation for TennCare Standard. So if they're below 211%, depending on family size again, then they could qualify for TennCare Standard to roll into that program up to age 19. And if they are above 211%, but they also have a qualifying medical condition, then they would qualify. And looking at the next slide, you have a good view of the landscape of these different programs. The different graphs indicate the category of people who qualify. So on the left, in the gray-colored bars, that represents children. And depending on the child's age, there's a different income cutoff. So, for example, a newborn, age 0 to 1, would qualify in a household that earns up to 195% of the federal poverty level. And above that, they could qualify for Cover Kids up to 250%. And then going over to a child that is 17, they can still qualify at 133% of the federal poverty level. And then above that, Cover Kids kicks in. The other category that we wanted to point out here is medically needy. Medically needy is a special category for people who have significant healthcare expenses. They are allowed to spend down from their income to qualify for TennCare in that situation. So we'll talk a little bit more about how that works in a minute. And then the pregnant woman category is that first blue bar line, and that's up to 195% of federal poverty level. That's the threshold for pregnant women to qualify for TennCare. And then for foster children, former foster children up to age 26 is represented by the orange bar on the graph. And that is a category that was created as a result of the Affordable Care Act. One of the popular provisions of the ACA is that parents could keep their children on their insurance up to age 26. Well, this is an acknowledgement for foster care children who are aging out of foster care without a custodial parent. They would also be able to stay on TennCare until age 26. There hasn't been much promotion of this provision, so we want to get the word out for former foster care children. If they do need this benefit, then it is available to them, and they can re-enroll in TennCare if their coverage has lapsed for some reason, and they want to remain on TennCare up until the age of 26. Okay, so let's talk about a couple of examples. Here we have Eli and Amy. Eli is 28 and Amy is 5. They recently had an income bump from $1,300 to $2,750 per month, and they have no resources. So the question is, what do they qualify for? So looking at their family size, for a family of 2, the TennCare cutoff is about, and Amy, given her age, so you have to kind of consult with a few different charts, but up to 142% of the federal poverty level is the cutoff for a child at Amy's age. And so looking at her family size or household size of 2, then the cutoff was $1,800. So now that they are above that, Amy no longer qualifies for TennCare, but she can roll into TennCare Standard. So again, TennCare Standard is available up to 211% of the federal poverty level, which for a family size of 2 would be roughly $2,800 a month. And so because they are under that limit, Amy can roll into TennCare Standard, and she doesn't have to show a qualifying medical condition because she's under that 211% level. So if Amy received a letter saying she's no longer qualified for TennCare, Eli can inquire about TennCare Standard and have her roll into that program up until the age of 19. It's very common for kids to lose coverage through the redetermination process that TennCare began roughly in the fall of 2016. They had not done redetermination for several years, but the law does require that states certify that enrollees are still eligible for the program, and so Tennessee began that process manually because it does not have a functioning Medicaid eligibility system. They've been working on a system for several years, but it's still not online. So they are doing the redetermination process manually, and unfortunately it's causing a lot of people to lose coverage because they either are not receiving the packet that they have to complete to send information to TennCare to show whether they still qualify, or there may be some mistake or bureaucratic error that causes them to be determined ineligible. So people are really having to be diligent and make sure that they are checking their mail and responding to TennCare and appealing if they receive a determination that they're no longer eligible, because they may not be manually screening people for other categories that they could qualify for. So that is an example for TennCare standard. Next, we'll turn to medically needy spend down. So if anyone in the household has high medical bills, children in the household from 0 to age 21 can qualify for TennCare under the medically needy spend down provision. So this allows the applicant and his or her family to subtract from their income any amount that are spent on medical expenses. Medical expenses in this situation include a laundry list of things like health insurance premiums, over-the-counter drugs, up to $10 a month per household member, any prescription drugs, dental costs, hospital costs, vision, hearing, walking aids, even guide dogs, any expense associated with those can be subtracted. So if the person subtracts those medical bills from their income and they fall below this spend down limit, then they can get medically needy spend down. So on the next slide, we see the Jetsons, just to illustrate this point. So you have a family size of 4. Unfortunately, Rosie the robot does not count. And they have a combined income of $4,500 a month. Elroy has $150 in medical bills. Judy has $2,000 in medical bills. Jane has $1,700, and George pays $150 per month on prescriptions. They also have $3,800 in the bank. So for medically needy spend down, you would add up all those bills and subtract them from their monthly income of $4,500. So with an income of $4,500 and the medical bills totaling $4,450, then the medically needy spend down limit for a family of 4 is $325. So the resource limit for a family of 4 is actually $3,200 based on the TennCare regulations, but they can spend down $600 from what they have in the bank on something in the home or a car, and it will not count against them. So using medically needy spend down, the Jetsons can get coverage for Elroy and take advantage of the medically needy spend down provisions for that. The next category that we'll look at is for newborn Catherine. Catherine is 2 months old. She was born with some health complications, and she's been in the NICU since birth. Her parents have a monthly income of over $9,000, and they have $1,500 in the bank. So they are well above the limit for their family size and income. But there is an option available to Catherine because she's been in the NICU for more than 30 days. Catherine qualifies for institutional TennCare. So institutional TennCare is available and allows Catherine to enroll in TennCare without accounting her parents' income against her. Because she's not living in her parents' household, she's actually living in an institution, then the parents' income is no longer imputed to her. So this is only available for children who've been institutionalized beyond 30 days. The institution could be a hospital, a nursing facility, but does not include a mental health facility. They would apply for institutional TennCare through healthcare.gov, and we'll share information about how to do that in the next few slides. So let's talk about a real-life example as well. This is Jace and Sheila Hobbs. Jace was born prematurely, and his biological mother struggled with drug addiction. Jace spent the first 10 weeks of his life in the NICU, and Sheila Hobbs and her husband Dave adopted Jace in 2016. Jace had significant health care needs, and in April 2017, he was admitted to Vanderbilt Children's Hospital for surgery to treat a seizure disorder, and he developed difficulty breathing that required placement of a breathing tube. After 2 months, he was ready to go home. However, his doctor said he needed home nursing in order to stay safe and healthy. Unfortunately, the Hobbs had an ACA plan that did not cover the services that Jace needed, and so they struggled to figure out how to take Jace home from the hospital. They earned $20,000. Their income would not allow them to pay out of pocket for the services that Jace needed. So for almost 5 months, Ms. Hobbs searched tirelessly for a solution for her son, and she called around to different agencies and tried to coordinate with the hospital staff to find the support Jace needed. Ms. Hobbs heard about the Tennessee Justice Center, and she was put in touch with us. And before she, gave up, she gave it one last try to see if there was a solution for Jace. And so a few weeks later, after working with the Tennessee Justice Center, Jace was approved for institutional TN care. Because he had been in an institution for more than 30 days, his parents' income was no longer counted to determine his eligibility for TN care. So you may ask, well, what happens when he goes home? Well, because he has TN care, once he's redetermined after he's home, then TN care will see that his parents' income is above the threshold and determine that he's no longer eligible for TN care. But in that situation, he can roll into TN care standard. So TN care standard would be available to him until he turns 19 in that situation, regardless of his parent's income, because he also has that qualifying health condition, and he has no access to group health insurance because the Hobbs, they are self-employed, and so they purchase individual plans from the ACA marketplace. So all of those factors combine to allow Jace the opportunity to have TN care until he is 19. So that's sort of a demonstration of how institutional TN care as well as TN care standard can work for certain people. So in terms of the demographics of uninsured children in Tennessee, we just want to convey that the uninsured issue can impact children at various income levels and ages. So this is just a breakdown by income or poverty level in terms of how many children in the state are uninsured. And then for ages, we see that the majority of uninsured children are between the ages of 6 and 17. So that means school outreach becomes an important way to connect families to these resources. So we're really trying to spread the information to people who work with children and families and who can help these people get connected to the enrollment assistance that's available. So how do families enroll in TN care and Cover Kids? So in Tennessee, we don't have our own application portal, and everyone has to go through healthcare.gov. And when you go to healthcare.gov, you may see a message along the lines of open enrollment is over, but you can still get health insurance if you qualify for Medicaid or CHIP. So enrollment is always open for those programs. So in terms of how they enroll, you would go on healthcare.gov and submit an application that way. The only exception would be for a couple of categories that are listed here, including presumptive eligibility. Presumptive eligibility is only available for pregnant women or women with breast or cervical cancer and newborns. And we'll talk a little bit more about how they enroll outside of healthcare.gov. Choices is for people with disabilities, not necessarily children, and then the Medicare Savings Program is for older people who are dually eligible for Medicare and Medicaid, and so those don't necessarily impact children, so we'll just talk about presumptive eligibility. The application checklist. It's a good idea for people to gather this information ahead of time to speed up the process of applying for insurance on the marketplace. One thing we wanted to point out is for employer and income information, which is the last bullet point on this slide, for people who don't have employment or they don't receive an actual paycheck, maybe they're paid in cash, they can still apply and submit form statements to attest to their earnings. And then on the next slide, we see just a continuation of the information that's needed to apply. As you can see, it's a lot for the average person to gather, and it's really important that people get assistance to maneuver this process. Unfortunately, only having applications available or accepting applications online presents a barrier for people who don't have access to a computer or the internet or are not computer literate to submit the application on their own. So through this campaign, we are connecting people who need the assistance to navigators to help them enroll, and we'll share the number for how people can get that enrollment assistance in a few minutes. But looking to those exceptions to healthcare.gov, one is for newborns. There are a couple of ways that newborns can be enrolled in TennCare without having to go through the healthcare.gov application process. Those are TennCare deeming, Cover Kids deeming, and the Newborn Presumptive Eligibility Program. So under TennCare deeming, this is for moms who are on TennCare. Their child is deemed eligible for TennCare for 1 year. The coverage starts on the date of birth, and you would call the Tennessee Health Connection to enroll at the number listed. So this is just a way to allow the child to not have a lapse in coverage while their application may be pending for TennCare. So it's important that the mom, during that first year, go ahead and submit an application for the child. But this is just a way to have coverage while that application is pending before a decision is made. The next one is Cover Kids deeming. It works similar to TennCare. So for moms who are on Cover Kids, the child is deemed eligible for up to 12 months. But here the coverage would start from the date the mother enrolled in Cover Kids. So it's important that pregnant women who qualify for the program get enrolled as soon as they find out they're pregnant, so they can start receiving the prenatal care that they need, and so that they can make sure that their child is covered when they are born. And for Cover Kids, they would call the 1-866 number listed to report the birth of the child once the mother has given birth, if she's already enrolled in Cover Kids. So then the next category is newborn presumptive eligibility. This is for babies who are born to mothers who are on private insurance or have no insurance. Again, they are presumed eligible for the first year of their life, and the coverage would start on the date of application. And how you apply is shown on the next slide. The parents would call the Tennessee Health Connection at the number listed to enroll the child in presumptive eligibility, but they still have to do an application on healthcare.gov. The child would remain eligible until a final eligibility determination is made on the application. So this is an option for pregnant women to have coverage while their application is pending for their unborn child. Okay, a few best practices to remember for TennCare and Cover Kids. It's important to sign all documents where indicated and answer any questions or write not applicable on the application. Also, it's important to open all mail from TennCare. A lot of times we're hearing that people receive packets and it's not clear that they are pertaining to their health insurance, and so they may not pay attention to them. But you really should be diligent about opening and timely responding to any mail that you receive from TennCare so that you don't lose coverage wrongfully. Also, TennCare must be kept informed of any address changes, because if they send the packet to the wrong address and the enrollee doesn't receive it and they miss a deadline, it can cause a lapse in coverage for them to get back enrolled and submit the paperwork that's needed. So we want to inform our clients, all of our clients, that it's important to make sure TennCare has the correct address. So I've talked a lot about enrollment assistance and how we want to provide this resource to families across the state who may need it. So for people who need help applying for TennCare or Cover Kids, we are sharing the Get Covered Tennessee hotline, which is 1-844-644-5443. That line is sponsored by the Tennessee Healthcare Campaign, not to be confused with the Tennessee Healthcare Connection. The Tennessee Healthcare Campaign is a nonprofit that works to help people get healthcare coverage in Tennessee. And they also partner with Family and Children's Service, which is another nonprofit that employs navigators to assist families across the state. Some of you may have heard about the cut to navigator funding under the current administration. So Tennessee has actually gone from having about 24 navigators across the state to assist people to about 4 navigators because of that funding cut. We went from roughly $1 million in a federal grant to $300,000. So with that loss of funding, they have had to scale back the number of navigators across the state that are ready to help people, but we are still pushing out the Get Covered line and making sure that families can get the assistance that they need. If a family calls that number, they'll be screened by a volunteer who answers the line for their eligibility for these programs, and if they want in-person assistance, they'll be connected to someone locally to help them get enrolled. And so several health departments have space for navigators to come and help families in person, and some navigators also have office hours at public libraries across the state. So families can be connected by calling that number and getting in touch with the navigators that are closest to them. The Tennessee Justice Center, which is where Anna and I work, is available to help people if they've been denied TennCare or Cover Kids unjustly. So we help people free of charge to file appeals to determine their eligibility for these programs. And our toll-free number is 1-877-608-1009. So a few barriers that we are aware of for people getting enrolled. One is income. So for people who are above 250% of the federal poverty level and don't qualify for any sort of special categories like medically needed spin down, then there's really not a great option for them, unfortunately, in the state of Tennessee. One thing that Tennessee is an outlier on is having a Katie Beckett waiver or a similar option for people who have children with significant health care needs in those middle to higher income households. Every other state has the Katie Beckett waiver or something similar that would allow these children to enroll in Medicaid without counting their family's income against the child. Unfortunately, Tennessee has not adopted any option for these families, but it's something that the Tennessee Justice Center is working on in partnership with the Tennessee Disability Coalition. So if you or someone you know would benefit from extending Medicaid to a child that has significant health care needs, we would love to hear your story. So feel free to reach out to the Tennessee Justice Center so you can get in touch with the advocacy efforts that we are embarking on to have the Tennessee General Assembly pass legislation to extend coverage to these families. Another barrier that we wanted to bring your attention to is immigration status. There is something called a 5-year bar for immigrants to access public benefits. and that's something that's imposed by federal law. States do have an option to seek an exception from the 5-year bar for immigrants, but Tennessee has not chosen to take advantage of that exception. So right now, even for lawfully present immigrants who live in Tennessee, they would have to be have their status for 5 years before they can seek public benefit. Something that is also impacting the immigrant community right now is the proposed change to the public charge rule, which would change the types of public benefits that would be counted against someone who is seeking to change their immigration status or seek green cards for their family members. So that is something that we are actively working on in partnership with Turk, and we would love to connect with you and share information about what we can do to protect the community of immigrant families who are being attacked by the change in this rule. And it's really creating a chilling effect for these families who are having to choose between seeking public benefit to help their family get health care or food and remaining in this country or having the ability to sponsor other members of their family who are seeking certain immigration status in the country. So we are aware of that chilling effect, and we want to mobilize efforts to try to stop that proposed rule change from going into effect. So if you want to get connected with that effort, also feel free to reach out to the Tennessee Justice Center. Another barrier that I wanted to mention is the family glitch. This is referring to a situation under the Affordable Care Act, which for purposes of calculating whether someone qualifies for premium assistance to purchase a plan on the Affordable Care Act, that process does not consider the cost of dependent coverage. It only asks whether the individual has access to an affordable employer-sponsored plan. And determining affordability doesn't consider the cost of adding a dependent to that employee's plan. So that's something that is a barrier for families who can't afford to purchase a plan on the Affordable Care Act and don't qualify for the premium assistance that's available, and they can't afford to add kids to their plan. So that's a real issue. One thing we want to point out is for adoption, there is an opportunity for adoptive parents to get TennCare included as a provision in their adoption assistance agreement, and that is under Title 4E of the Social Security Act. So children with special health care needs who otherwise may not be adopted can get Medicaid to make it easier for those families to care for their adopted children. We want to thank our partners for the Insure Our Kids campaign that are listed here. One that we recently added is Common Table Health Alliance in Memphis. We're really excited to strengthen our partnerships and connections in the Memphis area, and we're looking to connect with people in East Tennessee as well. So if you or someone you know in East Tennessee would like to get connected to the Insure Our Kids campaign, feel free to reach out to us or go on insureourkids.org for more information. But what we're asking of our partners is to help spread the word about the Insure Our Kids campaign and share the Get Covered number for people to get enrollment assistance. We also hope that you will go to insureourkids.org and check out 2 educational videos that we recently produced that sort of educate people about the programs and also share this number. So that is the end of our presentation today. If you have any questions, feel free to type them into the question box.
Okay, we have one question, and feel free to keep typing them in or email me after. My email is awalton@tnjustice.org. Okay, the first question is, if a parent is not a legal resident and has a child that was born in Mexico and is under 1 year old, but now lives in Tennessee, can the child get TennCare?
No, because again, if they are not citizens of the U.S., they would have to have lawful status in the States for at least 5 years before they can be eligible for TennCare. The only exception would be emergency TennCare, and so that's truly for a life-threatening condition or illness. In that situation, they may be able to get emergency TennCare, but unfortunately, they would not be able to get TennCare in this scenario because they weren't born here. And we still have 15 minutes left, so if anyone else has any questions, we'll wait just a minute for you to type them in. And if we sign off before you can finish entering your question, feel free to email Anna. Okay, well, seeing no more questions, again, thank you for your attention and for joining us for the webinar today. We really want you to go to insureourkids.org for more information or to connect with the campaign, and we are a resource for you. So if you have questions or would like an in-person training about the coverage options available, we're happy to travel and go out and do those trainings. So just reach out. Thank you.